What's up, you guys? Welcome back to my channel. It's your girl Aisha, and I am finally back with another video for y'all. Let me tell you, I think it's been like 5 or 6 months since I've uploaded my last video, and I promise y'all I did not mean to go that long. So welcome back to my channel. If you're new, welcome to my channel. I'm gonna take some time to talk about the supplies that I took with me to DR when I had my tummy tuck and my BBL, because I believe the question I got the most is which supplies did you use and which supplies did you not use. So I'm going to talk about which supplies that I feel like you absolutely need to bring this with you, and which supplies I feel like you could probably leave at home or do without it altogether. So before we get into the video, don't forget to subscribe to my channel, hit the notification bell so that you will know when I upload another video. And if you have any questions or comments, don't forget to comment down below and I will try my best to answer your questions. So without further ado, let's go ahead and get into the video. Okay, so I went to Dominican Republic. I had a tummy tuck and BBL February 23rd last year, 2021. I think it was February 23rd, 22nd and 23rd. So I'm almost a year post-op. I'm like 11 months and a few days post-op. So pretty much my results, the way I look right now, that's how it's gonna be. Like, that's what it is. I went to Dr. Giudicelli in DR, Dominican Republic, and I stayed at Radiance Recovery House. So if you see me looking down, I'm looking down at my list of things that I took with me to DR so I can tell you which ones I needed and which ones I didn't need. So I'm gonna start with the ones that I needed, okay? So these are the things that I feel like you absolutely need to take with you if you're going to have surgery in DR. Underpads. I didn't necessarily use underpads on my bed that I slept in while I was in DR, but I did use them for every single massage. She used, I believe, 2 underpads for every massage. If you're familiar with the lymphatic drainage massage, then you know that they push that liquid out of you, that fluid out of you as they're doing the massage. So you definitely need to have those pads underneath you to catch all of that fluid. My recovery house did have pads, but you had to buy them. And I'm pretty sure they were more expensive than just buying them here in the States and taking them with you. I don't know the price, the amount exactly, but just take them with you. Antibacterial wipes. Definitely need those. You do not want to take a shower in the water in DR after you've had surgery and you have open wounds. Their water is not treated like ours here in the United States, and you could easily catch an infection. So for that reason, you want to definitely avoid taking a shower or bath or whatever in DR after you've had surgery and you still have open wounds. So antibacterial wipes will be your friend. I use the antibacterial wipes to wipe down my body when I couldn't take a shower, just to make sure that I'm getting any, bacteria off of me, just getting me as clean as possible, without being able to take a shower. Feminine wipes, definitely need those. Like I said, you will not be submerging yourself into water in the DR after you have surgery. So to wash under there, to keep it fresh, keep it, like it's supposed to, keep your pH balance in check, I would definitely recommend taking feminine wipes with you. They definitely came in handy. Benadryl cream for itching. As your body starts to heal from lipo, it does begin to itch. The nerves are reconnecting or healing or whatever they're doing, and it does tend to itch. So I took the cream form of Benadryl that you could rub on your skin, and it did work for me for the itching. You will have to continuously put it on there, but it did work for the itching. I want to say I didn't start to feel lipo itch maybe until about a week or so after surgery. Urinal. This one, to me, it's kind of optional. That little female urinal, the little, I don't know, the tiny one that a lot of people get where you could like squish it, and don't get that one. Do not get that one. You are going to have pee all over your hands. It's not going to help you. Do not get that one. If you have to get a urinal, get the one that I had in my video. If you haven't seen it, I'll post the link here to the video. That urinal has a wide opening. You're literally just sticking under there and you pee and you pour it in the toilet. It's no mess, it's hassle-free. Now, the reason I say a urinal is optional is because you can sit on the toilet backwards and pee just fine. I think I used my urinal maybe 2 or 3 times, and then the rest of the time I just sat on the toilet backwards, used the bathroom. I was good. Pain medication. This one is going to be a personal preference. I will tell you that the pain medication that they prescribe to you in DR after surgery is not that strong. It's not strong at all. They're not going to give you anything like Percocet or nothing like that. It's probably the equivalent of Tylenol that they're going to give you. So if you want to take your own over-the-counter pain meds that you think will work better for you, then definitely do that. I took Tylenol with me, and I took their medicine plus Tylenol. My doctor said I was okay to take Tylenol on top of the medicine that they prescribed. Now, if you're gonna take I don't know, what is it, like Oxy whatever, or Percocets or whatever you want to take, make sure you can take that on top of the medicine that your doctor is prescribing. Girls do go down there and they take these very strong pain medicines, Percocets or whatever, and they take them along with whatever their doctor prescribed, or either they just take the Percocet by itself. I don't know. I'm not going to tell you to do that. If you want to do that, ask your doctor. Gloves, you definitely want to take gloves. My recovery house did have gloves, but I do remember a few times where a nurse came in and she asked me if I had gloves before she touched me, and I would give her the gloves that I brought with me. So definitely take gloves. Your travel container kit, I think that goes without saying. You want to put your lotions, your face wash, whatever, in a kit or a bottle that's 3 ounces or less, and take that with you. If you're not checking a bag, I didn't check a bag, so all of my liquids had to be 3 ounces or less. So if you don't plan to check a bag, then get a little travel kit to put all your liquids in. Antibacterial soap, I would definitely take that. I think the most common one that most people take is the Dow soap, the big yellow orange looking one. Everybody know that Dow soap, because they do provide you like towels and cloths and things like that at your recovery house, so you can kind of take a what they call it, a whole bath at the sink. Anything that is antibacterial, I would take that to wash with. You just want to make sure that you keeping your body clean and that you are doing the most you can to avoid any kind of infection. So in that video, I also showed you guys I had a little red squirt bottle that you definitely want to have, because along with the feminine wipes, I would fill that up with bottled water, okay? And again, do not use the DR water after surgery. When I use my Dow soap and I'm using that to clean me with the water, I'm using bottled water. They will provide you with a lot of bottled water for you to drink and for you to clean yourself with. So I would fill up my squirt bottle with bottled water, and I would sit on the toilet and squirt it down there with a little bit of soap and let it, you know, do what it do. Let it clean down there. So the squirt bottle is definitely going to come in handy when it's time to wash your area. What I would do is either hover over the toilet or sit on the toilet and squirt it down there with a little bit of soap, and then dry it off just to make sure that I'm keeping it clean and fresh down there. Without the squirt bottle, I think it would have been a little more difficult to clean down there. So I do recommend taking a squirt bottle with you. Hibiclens. Your doctor, before you go down there, when they send you a list of things that you need, they're probably going to have Hibiclens on there. Hibiclens, you can get it from Walgreens, CVS, whatever. It's pretty much it's the soap that you use to wash your body with the night before surgery. And I believe, if I'm not mistaken, they want you to wash with it 2 times. So lather up with it, or not lather, because I don't think it really lathers that much, but wash with it 1 time, rinse it off, wash with it again. That Hibiclens just, again, is getting all the bacteria off of your body, making sure that your body is clean, and that way you run less of a risk of developing some type of infection during surgery or after surgery. Hand sanitizer, don't think I need to explain that one, but yeah, definitely take hand sanitizer. Stool softener, I believe after any surgery or any major surgery, it's harder for you to poop for some reason. I've heard it has something to do with the anesthesia and letting the anesthesia get out of your system, but I don't know if it's the anesthesia, the medicine, or maybe your body's in some type of shock and you know it has to get back to doing its regular thing. I don't know, but after surgery it is harder to poop. I don't believe, and this may be TMI, but I think it took me a week to poop after surgery, but I was taking my stool softener so that when it did happen, that I wasn't straining, because I did have a tummy tuck, I did have a big incision, you know, everything was tight, everything was sore. I didn't want to be straining when it was that time to go do number 2. So I definitely recommend taking stool softener with you and to start taking it after surgery. Arnicare cream, you definitely need to take that when they do your massages, which they will start the day after surgery doing your massages. I believe I got 11. Yeah, I got 11 massages while I was in DR. I got one every single day after surgery. And when they do your massage, they'll use Arnicare cream. It's supposed to help with the bruising from the lipo, and I believe it's supposed to help with pain as well. But when they call you for your massage, they're going to ask you for your Arnicare cream, your pads, and that's how, you know, that's what they're going to use to do your massage. Lipofoams and boards. Definitely take your lipofoams and boards. Yes, you could buy them there in DR, but I don't know if the price is higher there or what. But you just got out of surgery, you're sore, you don't want to have to ask your recovery house like, hey, can I buy? I mean, you may. For me, it was just more convenient for me to already have it. So right after surgery, the day after surgery, they'll put you in your faja. That day, you won't have foams and boards inside of your faja. It'll either be just the faja, or either they'll put some maxi pads in there, stuffed down in your faja. I don't think my doctor cleared me to wear foams and boards until I was 1 week post-op. I went to my 1 week post-op appointment, and that's when he told me, okay, you're gonna go to your stage 2 faja, which is even more compression, and you can wear your foams and your boards. So take your foams, take your boards. When you get your stage 2 faja, you can go ahead and start wearing them. Slippers, you know, you don't want to walk around bare feet in the recovery house. I mean, I don't think you do. I don't want to. And you probably don't want to walk around in just socks. So yeah, take some slippers. Flip-flops, but when you have to go out, you do have to go to your post-op appointments. You do have to go to get fitted for your faja and wherever else you may want to go, you know, while you're there. Take some flip-flops, something easy to slide onto your feet and go. Compression socks, definitely need compression socks. They're going to put compression socks on you right after surgery, and that's just to help you not develop any blood clots, make sure the blood is flowing, you know, properly. A BBL pillow. Yes, you need a BBL pillow. You do not want to sit on your butt after surgery. Now, granted, when you wake up from surgery in the hospital room, yes, you're going to be laying on your back, on your butt. But after that, once you leave, you don't want to be sitting on your butt, and your doctor will tell you that, you know, your doctor will recommend however much time he thinks that you need to not sit on your butt. It may vary from doctor to doctor, but you will need a BBL pillow. There's a lady in DR, I believe her name is Natalie, and on Instagram I believe it's Natalie Boppy Pillows. So I bought a Boppy pillow from her. And this Boppy pillow is not the same Boppy pillow as the one that you would buy for your baby. You know, it's the same shape, but it's a little bit bigger and it's a little bit more sturdy. It's not as soft, because you don't want it to be too soft and you sit on it and then it, you know, like deflates or goes down. You don't want that. I believe you could buy either just the Boppy pillow or the Boppy pillow and the back pillow. I bought both, the Boppy pillow and the back pillow. I believe it was like $50. Yeah, I believe it was like $50 for that. The back pillow came in handy for me. Like, I use that thing so much, the boppy and the back pillow. I still have both of them because your girl is planning around too, so yeah. Well, let's talk about the things that I feel like you do not need. Depends. I took a whole pack of Depends with me to DR. I did not use not one of them. Not one of them. I did not use them over my faja. I did not use them under my faja. I didn't use them. You're not gonna need them. Don't take them. You're not gonna need them. Cough drops. Personally, I did not use any cough drops. My throat was not sore, which is the reason I took them, because a lot of girls say when they wake up their throat is really sore, their mouth is really dry, and they feel like they need to take cough drops. I didn't experience that. I don't believe my throat was ever sore after I woke up from surgery, so I did not need to take cough drops, but you may. I did end up giving some to some of the girls at my recovery house because they said that their throat was sore, but for me, I did not experience that. Off repellent bug spray. I don't think I really needed it. I don't think I needed it. I do remember that I left it out on the table at my recovery house for the other girls to use, because they said that they were getting bitten by bugs or whatever, while not inside the recovery house, outside of the recovery house they were getting bit by bugs. I wasn't outside of the recovery house that much. The only time I went outside of the recovery house was maybe to go sit by the pool area or to go get my faja or to my post-op appointments. Other than that, I wasn't really out of the recovery house long enough to, you know, be getting bitten by bugs. So if you plan to be out and about in DR, then maybe you may need to take some bug spray, but I would say no, you don't need it. Granny panties, don't need. You will not wear any panties with your faja in DR. You have an opening in the middle so you could pee. They will wash your faja every day for you, but you won't be wearing any type of panties. You have your faja in a robe or your faja in a like a little loose fitting dress or something, but you definitely won't have any kind of panties, so do not need panties. Scarway was a silicone gel that's supposed to help with healing of your scars. You will need that once you get back home. You won't need it in the DR because you can't use it until your scar is fully closed, I believe, or fully healed, and then you put that silicone gel on it to try to help lighten the scar or try to help it, you know, improve its appearance. But while you're in a I don't know how long you're staying. I stayed for 2 weeks, and it took more than 2 weeks for my scar to heal enough for me to use Scarway. Pants. I took a few pair of pants, like the little comfortable cotton pants that are quick to put on and very comfortable. You will not need, I'm not gonna say you don't need it. I would say one pair. You probably need one pair, and you can put those on if you leave the recovery house to go somewhere, to your appointments, to go get something to eat, to go to the airport or whatever. You probably need just one pair of pants. Maxi dresses, you only need one. All those maxi dresses I took, I don't think I wore any of them, but I would say you only need one. And again, that's for if you're leaving the recovery house, going somewhere, going to the airport, post-op appointment, going to eat, something like that. But other than that, you won't be wearing anything except for your faja and a robe. 99% of the time, you will be in just your faja and a robe, and that's it. Oh, that thick robe, that thick pink robe, I actually did not end up taking that because it didn't fit, because I only had a carry-on and a book bag, and it didn't fit with all my other stuff that I was taking, so I actually ended up not taking that robe. And good thing I didn't, because I didn't need it. The only reason I was taking that robe was to keep me warm in the hospital right after surgery, because I heard girls saying that it's cold in there and they're shivering, and that the blankets, or I don't know if the blankets are not that good or if they just didn't have enough blankets, I don't know. But if I remember correctly, it was cold in the hospital, but I don't think I woke up shivering like some people say they do. I don't think I woke up shivering, but I do remember that it was cold. My nurse, I want to say she gave me a blanket. I want to say she bought a blanket and she let me use it on top of the blanket that they gave me at the hospital. So I was fine. The night that I stayed in the hospital, the worst thing was the pain. Like I was in so much pain immediately after surgery, which is normal, which you'll hear girls say, you know, immediately after surgery up until about 4 days post-op, you are going to feel like you got hit by a bus, run over by a train, like an airplane fell out the sky and fell on top of you. Like you want to feel bad. You're gonna feel the first 4 days, they're the worst. I don't even think I could concentrate on it being cold because I was just in so much pain. And I remember I was in so much pain, I was delirious. I was texting my doctor. It had to be like, I don't know, it had to be like midnight, maybe 1 o'clock in the morning. I was texting my doctor like, doctor, can you get me some more medicine? They're not giving me medicine, I'm in so much pain, da, 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 da. And the next morning, his assistant messaged me. She was like, oh, Aisha, you're okay, I talked to your nurse, she said that you're okay, you'll be fine, it's just a little pain in the beginning and you'll be fine. And I was so mad, like, give me something stronger, they did, because I was in so much pain. They gave me some kind of pain medicine in an IV, because normally they will only give you a pill, some kind of pain pill to take, and it didn't work at all. So my nurse told them that I needed something stronger. They came in and gave me some kind of pain medicine in an IV drip, and that worked for maybe 2 or 3 hours, and I was able to get some sleep. And then once it wore off, it was bad. It was bad. Long pajama shirts, like I think I got a couple of them from Walmart or like Dollar General or something like that. I would say you probably only need one of those. Take one of those long pajama shirts. Like I said, you're gonna be in the recovery house most of the time, and while you're in the recovery house, you are going to only have on your faja, your compression socks, a robe, and slippers, and that is going to be it. All this other stuff, these maxi dresses, these pants, these pajama shirts, you're only going to wear those when you're leaving the recovery house. And you're not, I mean, depending on how long you're there, some girls stay there for a month, so you know they may be leaving the recovery house more than I was. I was there for 2 weeks. In those 2 weeks, I was recovering. The first 4 days, like I said, was the worst, but the whole 2 weeks you're still in pain. You're going to be in pain, some sort of pain, for at least 6 months after surgery. Those are the things that I think you need and the things I think you do not need for surgery in DR. Another question I got was, do you plan to have more surgeries? And the answer to that is yes. Right now I'm scheduled to have a breast lift and augmentation with Dr. Krau in Miami, and I am super excited about that because I have been wanting to go to him excuse me, I've been wanting to go to him for so long. Like, his breast work is perfect. If you're familiar with Dr. Krau, then you know his work is like immaculate. Like, if I'm gonna get them done, I'm gonna get them done right. I'm gonna go to Dr. Krau. Now, there are a few doctors in Miami who do excellent breast work, but I've always wanted to go to Krau. I don't know, I love his work. But anyway, I'm scheduled to go to Dr. Krau in May of this year, May 2022. Like I said, a breast lift and breast augmentation, and I am super excited about it. I cannot wait, so I'm going to keep you guys updated on that, letting you know what am I doing to get ready for that surgery, and I'm going to try to vlog some of it, you know, so I can show you guys what's going on, my progress, all that good stuff. Also, I want a round 2 BBL, so like the lipo 360 and BBL round 2. I'm on the fence about what doctor I want to go to. I'm in between 2 doctors right now. One is in the DR, Dr. Soto. I'm pretty sure if you did any kind of research on DR doctors, you've heard of Dr. Soto. He is one of the GOATs down there when it comes to performing BBLs, shaping, and all that stuff. So I'm stuck between him and a doctor in Miami, Dr. Cliff Cannon. I love the way he these shapes. I love the way Dr. Cannon shapes. I don't know, like I said in the previous video, I just feel like you get more bang for your buck in DR. I don't know. I feel like now that I've had round one, I can go to Miami and be happy with my results. I feel like, I don't know. But yes, I do plan to do that. I would like to do it before the end of the year, but we'll see. I'll keep you guys posted on that. But yeah, those are my future surgery plans as of now. I'll let y'all know if that changes. So anyway, I'm gonna insert a clip for you guys showing you what my body looks like now, and hopefully you guys like it as much as I do, because I am in love with it. It's a big improvement from where I came from. So yeah, your girl's in love. But yeah, that's all I have for you guys for this video. If you guys have any more questions about what supplies you think you should take with you to DR, or even if you're going to Miami, you still want to take some stuff with you. If you have any questions about what you think you should take or what you think you should not take, please feel free to leave them in the comment section below. Also, if you are familiar with Dr. Soto and Dr. Cannon, leave a comment below and let me know which one you think I should go to, because I am really on the fence right now. I have a friend who went to Dr. Soto and she looks bomb, like bomb.com. And then I seen a girl that went to Cannon and she looks bomb.com too, and I just can't decide. I can't decide, y'all. I can't decide. So yeah, leave me a comment below. Let me know what y'all think. Let me know what you think about Dr. Aury Krau as well. I am super excited to go to him to be getting my boob job, and I cannot wait. But that is all I have for you guys for now. Please don't forget to like, comment, and subscribe if you like my content. Don't forget to follow me on social media. You can follow me on Snapchat at It's Mayday. You can follow me on Instagram at Aisha the Goat. And I will be back with another video for you guys before 6 months. I promise. But until then, love you guys. Stay safe, stay healthy.